Good evening, everybody. Welcome to HEALTHline. I am Gregory Zarian.
And I'm Susanne Whatley.
It is so great to have you with us tonight. Okay, so tonight we are talking about the emergency room. And we are lucky because right here in this community there are 3 emergency departments that are here to take care of you and your families.
And in this episode of HEALTHline, we are going to be talking to a doctor who practices at really one of the best in town.
Right here in this community. And we're also going to be joined by a patient whose life has been saved twice by going to the rapid response at Glendale Adventist Medical Center's emergency department.
Now let's talk to Dr. Ron Lieberman first. He came out of one of the toughest proving grounds, a trauma center in the Bronx, which he likes to call the Knife and Gun Club.
Which sounds like a CBS series.
Yeah,
Joining us, Dr. Lieberman, how are you?
I'm well, thank you. How are you?
I'm good, and we didn't, so it's kind of like the Rough and Tumble Club too.
Yeah, make life easier that way.
You know what, I'm going to take that on. I love that.
What do you like about emergency medicine, especially as you're practicing it there at Glendale Adventist?
Well, the thing that drew me to emergency medicine initially was just the idea that you can help people in a very vulnerable state. They're frightened, they're scared. Many of them have never been to a hospital before. And just by your own demeanor and being personable with them and caring about them, you help them through a really difficult time. And at Glendale, luckily, everyone who works there, all the doctors and the staff, they're very loving, caring people. And we deliver that on a day-to-day basis. So the people that work there, I think, have been there some of them about 20, 30 years as a testament to how wonderful the place is, just the camaraderie amongst everyone and also just the quality work that we do.
Well, they have a great team and they stand behind their team, which always goes back to, I say here on HEALTHline, is the mission.
Yeah.
Whole person care and God's love. What kind of patients do you personally like to treat?
Well, always the nice ones are the easiest ones to treat.
So bottom line is be nice to your emergency room doctor. You'll get a lot farther. Thank you.
It's true. But still, we take care of everybody. Anyone who walks through the door, regardless of really anything. That's the beauty of the ER. You can always come there and you get help right away. Very efficiently, again, good quality of care. And it's just, we're trying to do good work for everyone.
That's fantastic.
When we come back, we're going to be talking to Dr. Lieberman about what it's like to help run an emergency department. He's the co-director, so stay tuned. I'm Susanne Whatley, and here's a health tip. Hospital emergency room visits related to tooth problems are on the rise, and not just in a small way either. We're talking over a 4-year period, 40 to 60% increases, and the related costs are going into the hundreds of millions of dollars. This is according to the Pew Center on the States, which looked at 24 states. What's the cause of this? Not brushing daily, after meals, not flossing regularly. Also in the case of children, sodas and candy, and in the case of toddlers, putting them to bed with juice or milk in a bottle. What can we do about this? We'll start with when you go to a restaurant, pick up the toothpick instead of the peppermint. Remember, if you ignore your teeth, they will go away. I'm Susanne Whatley, and that's my health tip for you. Here on HEALTHline, we're talking about emergency medicine, and our first guest is Dr. Ron Lieberman, who is the co-director of the emergency department at Glendale Adventist Medical Center.
Dr. Lieberman, talk to us about the responsibilities that you have as an administrator.
Well, we basically try to make sure that the ER runs smoothly, so that when someone comes into the ER from start to finish, that things are done expeditiously to make sure that that everyone's comforted, that things are done in a timely manner. So that comes from basically from when you first register in the ER to be coming back into the ER. Our goal is within 30 minutes to be able to see a provider, if not sooner, and to have all the tests and everything done hopefully within a couple hours. So we're trying to do everything as quickly as we can. And then through administration, we've done things about expediting and smoothing care as far as pneumonia. And Glendale Adventist is a stroke center and what we call a STEMI center, a heart attack center.
Right.
So the idea is that the team is ready to go at all times for any kind of emergency. So we're trying to be prepared on every level. So if it's from pneumonia to heart attacks to strokes, everything is streamlined and smooth.
When you come from, as you said, the Knife and Gun Club, do you find that experience allows you to bring more of a cohesive experience here at the Glendale Adventist Medical Center?
Well, I think all emergency rooms and all emergency room physicians live by the idea that anything can happen at any time and to be prepared. And the idea is to be able to know who you're working with, who your team is, and to know how to take care of someone, how to get out of a sticky situation. So that's one of the great things about Glendale, is because we have lots of resources at our disposal, a great call system with other physicians and specialists whenever we need to talk to them and get their advice. And again, it just comes back to taking care of people and giving them the best medical care they can get in the city.
Because one thing you said is that to be an ER doctor, you have to be pretty much a specialist in everything. Because if you're a specialist in heart,
yeah,
that you get to practice your heart and then go home, but you have to know everything.
Yeah, the question is if you understand the heart, but then you have to understand how the whole system works and how it might affect the brain and how it might affect the organs inside the body also. So we call ourselves emergentologists.
And you're always looking for different ways to improve things, and you mentioned to us before several committees that are all aimed at improving the practices there in the emergency department.
Yeah, this is the second part of my residency was getting into administration and to really see beyond just the medical side of it about how to take care of patients, but really how to run a department and how to make the department better. So one of the committees that I'm on, one of the multiples, the Clinical Improvement Committee, where we just hone in and figure out what needs to be improved as a hospital. And that's one of the beauties of Glendale Adventist, is that the thrust and the real focus is about how to help the hospital be better for the community. So we analyze everything. One of the things we've been doing is creating a sepsis program, which is overwhelming infection when people get sick, and to do this hospital-wide, and we've reduced our mortality towards about 14%, coming from 22%.
That's fantastic.
So it's fantastic. So
Wow.
we're saving lots and lots of lives just on this one basis.
And when you say committee, is it just looking at what's not working and creating solutions to make things work better and stronger and more efficiently, and have everybody be on the same page?
Yeah, it's assembling teams to figure out what needs to be done better. I know there were teams about bed sores that people would get and how to make that better to lower the rate, about ventilator pneumonia and how to get better testing to make this better also. And so we just kind of keep going one by one, figuring out what needs to be improved, and then the team will congregate, get together and do this. One of our newest ones we're doing is antibiotic stewardship, meaning not to use antibiotics just rampantly throughout the hospital, but to be able to keep it together. The truth is, once antibiotics the bugs become resistant, you have no more weapons to use against them. So we have to be very, very diligent about what and how we treat patients with.
Doctor, what's the most important part to you in regards to teamwork?
That's a good question.
I think it's the ability to communicate and to be able to operate well with people and let them know your ideas, and to be able to work well, especially in emergency situations, but in a clear manner, concise, slowly, so everyone can understand you.
I bet there's no place that teamwork comes together more than right there in the emergency department.
That's the conversation of saving somebody's life. When we come back, Dr. Lieberman is going to share with us ways to de-stress and also share with you the importance of knowing the signs and symptoms of stroke and heart attack. Do not go away.